Assalamu alaikum. This is a procedure of radical nephrectomy on the left side. The purpose of sharing this video is the difficulty in the pedicle. Here we have mobilized the colon, we have identified the ureter, and we have also dissected the lower pole of the kidney, and now we are on the hilum. The renal vein can be seen very easily. However, there is one branch of the renal artery which is popping up. So we change the direction of our 30-degree lens, and then we carry on with the dissection of the renal artery. After attaining sufficient space for the application of the first clip on the renal artery, we decide to clip the renal vein and then divide the renal vein. But as soon as we divide and cut the renal vein in half, we find that there is a lot of bleed coming from that cut portion. So the renal artery is clipped. As you can see, the renal vein is adequately dissected, and the clip is applied. However, you can see that the renal vein has not collapsed as much as we would have wanted. And now, when we cut it and make a hole in it, there is a lot of blood coming. It shows that there might be another artery. So we decide to place another clip, which reduces the bleeding, but it has created some doubts in our mind. And tissue has gone congested as well. So now we have to clean all the area, see if the clips are applied adequately, see if there is another artery. The clips are okay. We cannot find another artery at the moment. And after cutting, we find that there is still bleed, so we apply another clip, and then we will look for the other artery in between the two vessels. Still the vein is bleeding, so we have decided to buzz the artery with the Ligasure, which reduces the bleed, and we will quickly cut the vein, and we will quickly dissect the already clipped artery and divide it so that we can proceed further with our dissection to find the source of bleed. And then we quickly proceed with the further dissection. Dissection has to be really careful. There is no renal artery nearby. However, after mobilization of the upper pole at the border of the parenchyma and the adrenal gland, we find that there is another small artery to the upper pole, which may have caused the congestion in the vein and bleeding from the cut edge of the vein here. There is a small artery. It seems to be a branch to the adrenal artery. However, it is a small area of supply to the kidney. So We have clipped it, and now we will burn it and cut it with the Ligasure, and that completes our quest for the renal hilum and the vasculature. Thank you very much for watching.